firstly identifies the risk of a cluster of cases occurring in the European region, similar to what happened in Italy, again as moderate to high, which is the assessment it has had. It has added a new assessment where it identifies the risk of widespread sustained transmission occurring within weeks, somewhere in the European region as moderate to high. And it also identifies that the likely health system capacity impact, were that to occur within weeks, would also be moderate to high. We'll be working with that assessment and giving consideration to it, and in the context of our NEFIT meeting, we'll come up with whatever decisions are given rise to by virtue of that new guidance from the European Centre for Disease Control. In terms of the international situation, we now have 88,930 cases reported internationally, 8,756 which are outside of China. Looking at the European region, the top 5 countries, Italy has now seen 1,689 cases, Germany 129 cases, France 100 cases, Spain 45 cases, and the UK 36. And the situation in Ireland remains that we have 1 single case. And as you may be aware, there have been 3,043 deaths internationally. In terms of the kinds of issues we're giving consideration to at our NEFIT meeting tomorrow and making preparation for, we're giving some consideration to the issue of mass gatherings, ongoing consideration to our public health guidance, and to the question of community testing and the possibility of moving the burden of community testing from hospital environments out into the community. And some of the actions that we took today arising out of the case that was identified over the weekend. We wrote again to all schools today to provide reassuring information through the schools to all parents of children in the country. We met with a wide group of leaders of social partners and briefed them and encouraged their participation and support in helping to get the messages out, which was well received within that group, and will continue to engage with social partners in assisting in the national response to this. We continue the process of contact tracing in respect of the case that was identified over the weekend, and we'll provide you with more details of that. And we participated in the regular scheduled Health Security Committee meeting of the European Union. So, any questions?
So can I ask, just in terms of how many people have been tested? Sorry, Richard Chambers from Virgin Media News. How many people have been tested for coronavirus in Ireland at this point?
So we'll give that number tomorrow. We'll give it every Tuesday in respect of the week that ends on the preceding month, so it'll be this evening's total. The last week it was 90. It's an out-of-date figure now. We expect that number to increase significantly on the basis that on Tuesday of last week we greatly widened the areas that were within our case definition to include not just mainland China and some countries in Asia, but also northern Italy and Iran.
You've given us an indication there from European Centre of Disease Control, increasing the risk level. Do we expect heightened restrictions to come into force in Europe, and perhaps do you expect there to be heightened restrictions here in Ireland to try and prevent the further spread of coronavirus?
So one of the first thing I'll say is we will give consideration to this new advice. At this point, we're not anticipating restrictions that are applied generally as a result of it. We still remain in a containment phase in this country. 1 case has been identified. The measures that have been put in place, both in terms of the clinical response to that case and the public health response to that case, give us confidence that we should be in a position to prevent onward transmission, and we remain vigilant in terms of the detection of cases. And although we've accepted that advice from the European Union, we'll plan on that basis. We continue to anticipate that we'll get small numbers, hopefully, of sporadic cases.
Can I ask just in terms of contact tracing and the school in question here, your advice at the bottom saying siblings not attending the school concerned, parents and other members of the community aren't regarded as contacts and can continue their daily routine as normal. We've had a lot of questions about that. Can you just explain how exactly does that work, that they're not contacts?
There's a clear explanation. I might ask Dr. Glynn, who will be in a position to do it almost graphically, which is easier to understand than a verbal description. But it's the first generation of contact with the case that gives rise to concern for us. Ronan, you want the microphone?
So obviously we've had a lot of questions in the last 24 hours about what constitutes risk of transmission. And so, we we talk about contacts and contacts of contacts, and it can be quite difficult for people to relate to what we're saying. So I thought maybe a graphical representation would assist. So if we take a case, and I'm talking in general terms here, I'm not talking about the case at the weekend. This is the process that applies in any contact tracing process. So if we take a case, so at a point in time, that person becomes symptomatic. They cough, they sneeze, and they have a fever. So they're then obviously tested for COVID-19. And at that point, if they're positive, the public health doctors start the contact tracing process. And a key part of that process is to identify anyone who's been a close contact of the index case. So this is the index case. We then need to identify over the following 24 to 48 hours anyone who's been a contact of that case in the time that they were symptomatic. So in any contact tracing process, you will identify a certain number of close contacts. It is only the close contacts that are at risk of infection from the index case. So in any contact tracing process, we are looking to identify the index case and all close contacts of that index case. We are not concerned about contacts of contacts. So there is no risk of transmission to a contact of a contact. So whether that's parents, whether it's people in the community, on the street, if they haven't had direct close contact for up to 15 minutes or more with the index case, whilst they had a temperature, whilst they were sneezing, coughing, etc., then they are not at risk. They're free to go about their normal business. They don't need to stay off school, work, etc. They carry on with their everyday activities.
The current Department of Health position is that the risk of contracting coronavirus in Ireland is still low. But the European Centre for Disease Control and Prevention obviously has raised its risk level today from moderate to high. And you'll have seen in the UK, Public Health England, which is essentially the government there, said today that widespread transmission in the UK is highly likely. So Britons over there, we're here. They're taking quite a strong position, very strong lines. What would you say to those people who suggest we're underplaying it here? Why such a huge difference as of now between us and Britain?
So there isn't a difference. Those positions are compatible. So the British assessment is really similar to the assessment for the whole of Europe that I shared with you from the European Centre for Disease Control. That's our planning assumption, that the risk of widespread transmission occurring within weeks within Europe is moderate to high, and that's consistent with the position in Britain. When we say that the risk for a person now, it relates to our belief. We've had one case in this country, no community transmission happening here and now. So the risk of a person today in this country contracting this disease in this country, we think is low. And we're taking into account local factors when we make that assessment. That does not mean that we don't share and accept the advice of the ECDC that the risk of that changing to become the patterns that they've identified of either clusters occurring or of widespread transmission occurring within weeks, that risk of being moderate to high, that's part of our planning assumption. But that's not inconsistent with saying that the risk today of a person contacting this disease in this country is low.
You say that contact tracing is underway. Just explain that it's ongoing, or what's happening there in relation to that. Are we just talking about the school and that, or something else?
The contacts of this case have now been identified, and public health have communicated with them. And as we described before, that advice that's communicated is around restricted movement, and they have daily monitoring by public health.
All contacts have been.
Yeah.
Sorry, you said we could anticipate clusters in a couple of weeks. Like we might escape that effectively in Ireland. But how is that compatible? Then we were talking about the sporadic number of cases. Is that which is it that we're going to get? Is it going to sporadic cases in the short term, but then in the medium term clusters? Is that it?
So the position in relation to clusters is the advice given by the ECDC, which it initially provided to us so a week ago yesterday, as a result of the Italian experience. It identified the risk of community clusters of transmission occurring as moderate to high risk, and that continues to be the situation. That hasn't changed. They've added to that now the risk within weeks of widespread sustained transmission within the European region as a moderate to high risk. What I'm saying in terms of sporadic cases and the case that's occurred here, we expect to still see sporadic cases occurring. We think we have no documented evidence in this country of community transmission or other cases than the one that we've identified, and therefore I think it's reasonable for us to conclude that the risk of a person contracting this infection in this country today is low. But that does not mean that we're not planning on the basis that the risk of clusters or of widespread transmission as identified within weeks by the ECDC is something that could occur.
That could include Ireland, just to clarify that, you know, you're not excluding Ireland from that potential.
We're part of the European Union, and the advice of the ECDC applies to us. We will then take into account the local factors that are different, because they're providing that assessment for the whole of Europe.
Can I just ask, the department is still identifying the school as a school in the east of the country. Several papers reported it today that the name of the school, Mary Lou McDonald's, acknowledged the school, and the school even have a notice acknowledging it on the front of their door. I was just wondering why the department has yet to identify the school publicly.
So I explained last night, and I'm happy to explain again, we won't be identifying schools or any other parts of the contact tracing in respect of an individual case. We won't be identifying any more information in respect of the case other than the sex, the north, south, east, west of the country, and whether that's associated in contact with the case or importation from an affected area. And we've made that clear. We accept the reality that with schools, large numbers of people are involved, significant numbers are involved in communities, that it can lead to the identification of schools, and that's what you're referring to. We still think it's an important principle for us to uphold, to be able to advise people to come forward, to seek help, to trust that their information, their confidentiality and their privacy will be fully respected by the health profession. That's a core principle of the delivery of health services, and that principle will not be broken by us.
Hi, Ciara Phelan here from the Irish Mayor. I'm Dr. Tony Hoolan. A question for yourself. You spoke previously about having it might be the likely case that we would see some imported cases here in Ireland. I just would like to ask you, the Global Alcohol Policy Convention, which will be co-hosted by the Department, is to go ahead next week. Around 1,000 people from countries, some infected, are expected to attend here in Ireland. I was just wondering why the Department are going ahead with this event next week when they have decided to cancel the Irish and Italy rugby game. There's people coming from all around the world.
So there were unique factors behind the decision to recommend the cancellation of that particular fixture, the rugby fixture that was due next weekend. And it related to travel of large numbers of people from an area that was affected, where there was significant community transmission taking place, and that was the north of Italy, and those people coming for a specific mass gathering. And so we gave that specific event consideration at the NEFIT meeting last week and made that recommendation. We also decided to develop guidance in relation to mass gatherings in general, and we'll be considering that further at our NEFIT meeting tomorrow. We anticipate being in a position to provide guidance for the organisers of gatherings of all sizes, to enable them to risk assess for themselves, because we've been asked questions about whether meetings in the way that you've done, meetings of various sizes and compositions should go ahead, whether people from certain countries should be allowed to attend and so on. And we think that this will be a means of providing a clear and coherent position. We'll continue to listen as we develop that guidance and apply it to the advice of the ECDC and others in relation to mass gatherings. But right now there's no indication for that particular event to be cancelled, and I'll be involved and I'll be attending that one myself. Okay,
should we not be cautious about this? Like, we did see a man from the UK who was dubbed the super spreader. He actually picked up the coronavirus while at a convention in Singapore. I'm just wondering why you have said that we are likely to see imported cases here from infected countries. Why isn't the Department of Health cancelling events whereby Irish people could be put at risk from people travelling over from infected countries to Ireland? I don't understand why the Department of Health wouldn't cancel these events.
I mean, as part of the response in general terms to an infection like this, the cancellation of mass gatherings or certain mass gatherings can form a part of the response. And that's the reason that we're identifying the guidance that I spoke to you about and that we're going to be considering further tomorrow. But we're not at a phase at this moment in time where we think there's any indication to cancel mass gatherings of the kind that you're describing.
Okay, so it's possible that you don't expect any cases to be confirmed then after this event?
And that's not what I'm saying, but I don't believe that you're identifying a specific event. I don't believe that there's any justification for us right now to recommend the cancellation of that event.
Okay.
And as I say, I'll be attending myself.
Can I just ask you, might seem a glib issue compared to the other ones, but just to do with hand sanitizers, they've sold out. Lots of people are tweeting that hand sanitizers are sold out. There's an element, I suppose, of panic buying. Is there a need for hand sanitizers? Are they not antibacterial? Do they work with the coronavirus? And should people be worrying if hand sanitizers are sold out?
Hand sanitizers, to answer your question, do work, but I suppose the mainstay of infection prevention control here is hand hygiene. So hand washing with warm soap and water is equally effective. And the other aspect of that we've talked about is respiratory etiquette, which is covering coughs and sneezes with the tissue, binning the tissue and washing your hands. So those basic measures, also keeping hands away from the eyes, nose and mouth, all effective and all basic measures of infection prevention control.
Hi, I'm still struggling to understand the approach to the school whose name we won't mention. I looked up the British regulations and they say in most cases the closure of a school won't be necessary. So I'm trying to understand, excuse me, are you considering contacts within the school all to be at the same level, whether the person is in the same class as the index case or a different class or whatever? And when you talk about, say, the contact tracing being completed for the two cases, does that embrace the close contacts or also what I think is defined as casual contacts?
I suppose
Does that make sense?
Yes, it does. In each setting that we conduct contact tracing, I think, is unique. And we do a risk assessment of the setting, and that would include the layout of the particular building. And in this case, our risk assessment identified the contacts, and one of the measures then subsequent to that was that closure of the school for the incubation period of 14 days was indicated. We've also, as I mentioned, indicated restricted movement for the contacts and ongoing monitoring by public health. So that's the response that was indicated from the thorough risk assessment that we carried out.
Were they all considered to be on a par at the same level of risk, the students from first year to sixth year, whatever classes they were in, and teachers?
Again, for some of the reasons that we've explained, we don't want to go into the details of who was in contact with whom and so forth. But
in general,
overall, the risk assessment indicated the outcome that I've described.
Okay, and then when you talk about contact tracing being completed, do you only just contact the close contacts?
No, in the contact tracing process, we've identified the contacts and we've communicated with them. So
close ones.
We identify any relevant contacts, and we give them the appropriate advice.
Okay, it keeps changing. Like the distinct statement yesterday referred to possible contacts.
Oh.
Now you're saying relevant contacts.
Well, we identify all contacts, and then we give them the appropriate advice.
And every person in the school, staff, student, there was a letter received in respect of each one of them. Same letter in respect of each one of them, yeah.
Since this press conference began, I've received loads of messages from random followers essentially asking about X case which is going to unfold in X university or X public institution. There's a lot of misinformation. A lot of people are panicked and spreading fear about this. I mean, what would your message be to them? I mean, when you have cases and you identify positive test cases, you will disclose all of them. That's clearly the protocol here, isn't it?
That's clearly the protocol. So there has only been one positive test in this country today, and that statement is correct up to and including all tests that were done today. So there's no other case, and where there's rumours, and I've seen them myself in social media, of cases in hospitals. I've even had medical friends of mine assuring me I know about it, etc. There is one case in this country has been diagnosed. There are no other positive cases anywhere else in the country that we know of. The testing is finished for today.
Just on the testing, I know you spoke about it and did a graph there for us, but I was just wondering, Dr. John Cuddihy, what is your message to parents that, I know, and you're not identifying anyone, I just want to know what the message is to parents that their kids might have come into contact or close contact with this infected male at extracurricular activities such as GAA grounds or, you know, just some playgrounds. How is it manageable? This is a question as well, like Richard had said, come in. How is it manageable to contact all of the people?
The contacts that you refer to, the close contacts of the confirmed case, have been identified through the contact tracing process, and public health have communicated with them and given them the appropriate advice according to the guidance, which is to restrict their movements, and to they will have monitoring daily by public health. So as Ronan illustrated up here, people who are outside of that group do not need to be concerned about transmission from the index case.
Okay. Was the school cleaned?
The school is cleaned according to the infection prevention control guidelines.
So it has been cleaned then since the case has been
Yes.
Okay.
Hi, Tesgon Sean from the Journal.ie. Is there any situation where you will kind of relax the protocol that you've been doing in terms of identifying schools or workplaces if it ever got to a stage where the coronavirus was widespread in Ireland and you move from maybe the containment phase to the mitigation phase? Will that policy ever change in terms of how you identify cases?
No. The only thing I'd say is that if there was a circumstance in which an exposure in a contact tracing process was identified and the only means of contacting the individuals was to identify, for example, a particular mode of transportation, everybody on the 5 o'clock bus to Ennis or whatever it may be, then that might happen. That has happened before in respect of measles. And were that necessary, it would happen. It hasn't happened because it wasn't necessary. And in the context of coronavirus, we don't anticipate any such measure being necessary. We don't anticipate relaxing our rule in terms of protecting confidentiality and privacy.
And just another question, just in terms of the advice you're giving people to make contact with relevant health authorities if they feel symptoms, and you say that they should ring up their local GP, etc. What advice would you give to people who are maybe deaf or hard of hearing that would not be able to do so?
Well, relative, I would expect, would do that for them routinely and would do so in this case as well.
Okay. One last question, please. Can I just ask how many of the kids that have been in close proximity showing any symptoms, and how many people have been tested now since this has been confirmed with that school?
So we won't be giving an update on those. We'll simply describe the arrangements that are in place as they would be for all contacts where there's what we call active surveillance. There's a daily text message from the HSE asking in respect of symptoms, and there's a follow-up in respect of any that indicate that they may have symptoms to maximise the chance of early detection of a case. We won't give details in this situation or in any other situation of the numbers of suspect cases, the numbers that are subject to testing, other than just through the weekly update and the total number of tests. Yeah.
What is the likelihood of us getting another confirmed case here?
Arising from contact in the school.
And outside school.
So
Both inside school and outside school.
related to this particular case is your question, is that right?
Yeah, at this case and another, if there's someone else that has travelled in from northern.
So we really expect to see more cases coming in through importation. We do, and we're also preparing for the eventualities, as I've said, that the ECDC has now indicated are moderate to high risk. That is either of clusters of cases occurring or widespread community transmission within weeks. In relation to a particular case, the one confirmed case that we've had here that's involved a school, we don't think that we think it's a low risk of further infection occurring from that, but it's still something that could occur. It looks to us in the international community and looking at the evidence from China that close contact, household type contact is important in the transmission of this particular virus. And that gives us some reason to believe that this precautionary measure that's been taken is a proportional one, but that the risk for children and staff in the school in question is probably still low. But that doesn't mean that we'd be surprised were a case to occur. And a cluster isn't a specific number. There isn't a guideline as a specific number. It's a small number. It implies that measures could contain that, but it involves person-to-person transmission because that's the means through which this infection is spread. Widespread community transmission is something much, much more broad than that.
Thank you.